The approach that I've outlined here would confer substantial, sufficient, and timely benefits both on individuals and on the nation as a whole. There would be no cancellation or cutting of current entitlement programs such as Medicare and Medicaid. Each of us would simply have a choice whether to depend on or surrender access to these programs. Patient autonomy would be protected and improved, and the provider-patient relationship would be strengthened rather than weakened. Universal coverage would be accomplished by means of appropriately and efficiently directed public support. Patients would be empowered to achieve and maintain health due to improved availability of resources and heightened engagement of individuals in the care of their own health. Medical coverage would rapidly become completely portable, but could still be offered as a benefit by employers. Government programs would face competition for clients and would be obliged to improve their service. Medicare and Medicaid would either evolve into a new state of efficiency and solvency or fade away by attrition. The former possibility would make it possible to much more easily control costs or convert these programs into defined contribution efforts. The latter possibility would reduce the federal government's role in healthcare to that of a distributor of funds to the needy, according to legislated rules and budgetary constraints. Either would eliminate the crushing national economic burden of the unfunded healthcare entitlements. What would happen if we were to take this approach? Initially, those who do not expect to ever benefit from Medicare or Medicaid, which is many of us, would begin setting aside funds to their toward their own health care, taking advantage of the tax-free opportunity presented. The attention of healthcare providers and insurers would focus on these people and their dedicated funds, and they would create and offer innovative services and products tailored to the demands of this new market. American healthcare would surge forward, both in efficiency and in efficacy. American health would significantly improve, greatly promoted by the newfound motivation of consumers and patients to make the most of their sufficient but limited healthcare funds. Charitable and community-based support of those in need of healthcare services would blossom. Government programs would either evolve into cost-controlled defined benefit insurance services, or, more likely, they would continue to attempt to achieve better health for their clients by increasing regulation of providers and interference with the decisions of patients. Providers would increasingly cater toward the interests of self-determined healthcare consumers rather than third-party payers. And many who qualify or expect to qualify for Medicare and Medicaid coverage would realize that their government-sponsored healthcare is or will be inferior and would opt out of these programs in favor of the self-determined approach. Our government's unfunded healthcare obligations would resolve into a manageable, sustainable, budget-restricted program by means of tens of millions of individual decisions by American citizens. We would all enjoy better health, promote a stronger national culture, and at the same time dodge a $90 trillion bullet. Think about it.